Good day, ma'am. I'm Stephanie Lady Frayres, and I'm your nurse for today. Before we start, I will assure you that your privacy and confidentiality will be considered at all times. So, ma'am, may I know your name?
My name is Michelle Mendoza,
How old are you?
21 years old.
Okay, ma'am. So, how may I help you?
I have a problem regarding the use of family planning. Can I ask some advice because I am in second year of my postgraduate college and I have one child, then I want my next child after graduation in 3 years. However, I don't have any idea in family planning.
Okay, I get what you're getting at. I have prepared health teaching resources that may be of assistance to you. I will explain to you what contraceptives are, its important and how to use it. But first, may I inquire if you're on any medications? Are you allergic to anything?
Ma'am, I'm not on any medications right now and I don't have any allergies either.
Okay, ma'am. So first, let's discuss about the basic, which is what family planning is. So family planning, or FB, defines the individuals and couples to anticipate and attain their desired number of children and the spacing and timing of their births. It is achieved through use of contraceptive methods. So the benefits of this is to avoid unplanned and high-risk pregnancy, reduce physical and emotional burden on parents, avoid disease from overcrowding, and making the most of income and opportunities. So we have two methods. First is the fertility awareness based on FAB method. Fertility awareness means the ability to know if a woman is fertile or infertile to determine if having sexual intercourse on the particular day could result in pregnancy. It can be used to understand your own menstrual cycle and of course to avoid pregnancy. The different types of this method are basal body, temperature, calendar method or rhythm method, standard days method, mucus or Billings method, symphythermal method, and lactational amenorrhea method. The other method is the contraceptive methods, and the different types of these are combined oral contraceptives, progestin-only pills, injectable contraceptives, hormonal implants, tubal ligation, and vasectomy, barrier method, and the emergency contraceptions. Calendar method, women need to keep a record of the length of each menstrual cycle in order to determine when they are fertile. Next is the standard days method, or SDM, which is based on a calculated fertile and infertile period for menstrual cycle lengths that are 26 to 32 days. Women who are qualified to use this method are counseled to abstain from sexual intercourse on days 8 to 19 to avoid pregnancy. Next is the mucus or Billings method. It changes in quality and quantity just before and during ovulation. After menstrual period, there are usually a few days without mucus. These are called dry days. This may be safe days if the cycle is long. When an egg starts to ripen, it's also artificially fed or started on solid food. And if the baby is 4 months old or more, now let's proceed to other method, which is the contraceptive method, and the different types of these are combined oral contraceptives, progestin-only pills, injectable contraceptives, hormonal implants, tubal ligation, and vasectomy, IUD barrier methods, and emergency contraception. Let's start with the combined oral contraceptives are available in 28-day packs. One hormone-containing pill is taken once a day for 21 days, followed by 7 placebo pills given once a day for the final 7 days.
How to use this pill? What are the side effects and are there any warning signs? How to use this pill? What are the side effects and are there any warning signs?
Each day, take 1 tablet. If you miss 1 or 2 active tablets in a succession, or if you start a pack 1 or 2 days late, you should, as soon as you recall, take a tablet. Continue taking 1 tablet each day. There is no need for additional security. If you miss 3 or more active pills in a row, or if you begin a pack 3 days late, take a pill as soon as possible. Then, one pill every day for the next 7 days and use condoms or avoid sex. There are possible side effects, which are spotting, amenorrhea, nausea, breast tenderness, and headaches. Also, it has warning signs such as jaundice, abdominal pain, chest pain, headaches, eye problem, and severe leg pains. Next is progesterone-only pills. Is estrogen-free oral contraceptives with a low progesterone dosage. Mini pills are another term for progesterone-only pills. POP are beneficial to breastfeeding mothers and can even be consumed by non-breastfeeding mothers. They can begin taking the pill at any point during their menstrual cycle. Next is the injectable contraceptive. The injectable hormone is slowly released into the bloodstream from the injection site. Its synthetic steroid hormones that resemble the female hormone, progesterone, are used in progestogen-only injectable contraception. Next is the hormonal implant. Implants are small, flexible capsules that are inserted just beneath the upper arm skin. It protects you from getting pregnant for a long time. To insert and remove, a specially skilled provider is required. Once the implants are in place, the client will have less work to do. Changing the pattern of bleeding is an observation, but is not detrimental. Methods of emergency contraceptions are the copper-bearing intrauterine devices and the emergency contraceptive pills. A copper-bearing IUD is the most effective form of pregnancy contraception available. Now, ma'am, have you decided which method you will use? Every method has its own side effects, and it is better if you will decide which method will be good for you. Feel free to ask if you have some questions or worries.
I think the injectable implant will be better for me, but I will also talk to my husband.
That's good, ma'am. If you're already decided to have an implant, I can refer you to a doctor to do the procedure. Possible, I want to practice the natural method to also lessen the expenses. So I assume that you already have an idea in family planning. So let's now proceed in discussing the other natural method for family planning. So the fertility awareness based or FAB method is what we call natural method. Fertility awareness means the ability to know if a woman is fertile or infertile to determine if having sexual intercourse on a particular day could result in pregnancy. It can be used to understand your own menstrual cycle and of course to avoid pregnancy. The different types of this method are basal body temperature, calendar method or rhythm method, standard days method or SDM, mucus or Billings method, symptoterminal. Good day, ma'am. I'm Stephanie Frayres and I'm your nurse student for today. Before we start, I will assure you that your privacy and confidentiality will be considered at all times. So, ma'am, may I know your name?
My name is Michelle Mendoza,
How old are you?
22 years old.
Okay, ma'am. So, how may I help you?
Currently, I am practicing the lactational amenorrhea method or LAM, but I am a bit scared because my menstrual period returned and I want to postpone my pregnancy for 2 years. And as much as possible, I want to practice the natural method to also lessen the expenses.
So I assume that you already have an idea in family planning. So let's now proceed in discussing the other natural method for family planning. So the fertility awareness based or FAB method is what we call natural method. Fertility awareness means the ability to know if a woman is fertile or infertile to determine if having sexual intercourse on the particular day could result in pregnancy. It can be used to understand your own menstrual cycle and of course to avoid pregnancy. The different types of this method are basal body temperature calendar method or rhythm method, standard days method or SDM, mucus or Billings method, symptothermal method, and lactational amenorrhea method, which is the method you are currently practicing.
Based on what you have said, I can say that there is really a lot of ways for family planning. Is it okay if you discuss it all precisely?
No problem, ma'am. So let's start in basal body temperature. So women's body temperature is lower during the first part of your cycle. It usually rises slightly after ovulation or when an egg is released. The body temperature stays elevated for the rest of woman's cycle. It falls again just before your next period. So ma'am, to this method, you have to track down your body temperature every day. This can help you to know when you are ovulating. Pattern of body temperature may change when women don't get enough sleep, some illness, stress, jet lag, or smoking. Next is the calendar method or rhythm method. It works best in women with regular cycles. With the calendar method, women need to keep a record of the length of each menstrual cycle in order to determine when they are fertile. Next is the standard days method or SDM, which is based on a calculated fertile and infertile method for menstrual cycle lengths that are 26 to 32 days. Women who are qualified to use this method are counseled to abstain from sexual intercourse on 8 to 19 to avoid pregnancy. Next is the mucus or Billings method. It changes in quality and quantity just before and during ovulation. After menstrual period, there are usually a few days without mucus. These are called dry days. These may be safe days if the cycle is long. When an egg starts to ripen, more mucus is produced. It is generally yellow or white and cloudy. It feels sticky or tacky. Before ovulation, it looks clear and feels slippery, like raw egg white. It can be stretched between the fingers. These are the slippery days. It is the peak of her fertility. Another one is the sympothermal method. This method uses a combination of calendar, temperature, and mucus method to work out the fertile time of the cycle. It has the advantage over using just one method in that woman can compare symptoms and signs to better pinpoint ovulation. Last type of this method is lactational amenorrhea method or LAM, which is you already know. Now ma'am, have you decided which method you will use? Every method has its own side effects and it's better if you will decide which method it will be good for you.
Based on your explanation, I prefer the standard days method or SDM. I think it will be better for me, but I will also talk to my husband.
That's good, ma'am. If you already decided to the standard days method or SDM, you can come again here to buy the cycle beads because SDM use a device, which is the color-coded cycle beads to mark the fertile and infertile days of your menstrual cycle. SDM is 95.25% effective with correct use and 88% with typical use. Good day, ma'am. I'm Stephanie Frayres. I'm a nurse for today. Before we start, I will assure you that your privacy and confidentiality will be considered at all times. So, ma'am, may I know your name?
My name is Michelle Mendoza.
How old are you?
36 years old.
Okay, ma'am. So, how may I help you?
I am here to ask an advice for family planning. I have 5 children and I had an abortion 5 days ago. And I don't want to undergo the same experience. I wanted something to protect me from becoming pregnant, but I don't want the pills.
Okay, ma'am. So now let us proceed to your options about the contraceptives. Feel free to ask questions, ma'am. The FAB technique is divided into 6 categories. The first is basal body temperature or BBT, which is when you take your temperature every day to see if it can help you to figure out when you're ovulating. Women's body temperature patterns may vary if they don't get enough sleep, are unwell, anxious, have jet lag, or smoke. Your body temperature is lower in the first part of your cycle. When an egg is released after ovulation, it usually rises somewhat. The body temperature of a woman remains elevated for the duration of her cycle. Just before your next period, it starts to drop again.
How does this basal body temperature chart work?
A BBT chart examines changes in your basal body temperature that occur during your cycle over the course of many months. If your BBT level has grown somewhat, you've ovulated. Having the information shown on a graph over time might assist you in determining when you're most likely to become pregnant. The second option is the calendar method, which works as well for women who have regular periods. Women must keep note of the length of each menstrual cycle in order to use the calendar approach to determine when they are fertile. Look through your records for the longest cycle to utilize this. The overall number of days is reduced by 11 days. Count the number of days that have gone since the first when you're counting. Don't forget to include the first day. The last fertile day is marked with an X. The third approach is the SDM, or Standard Days Method, which employs color-coded cycle beads to identify fertile and infertile days of menstrual cycle. SDM is 95.25% successful when used correctly and 88% effective when used incorrectly. It is based on an expected fertile and infertile time for menstrual cycle lengths to 26 to 32 days. Women who are qualified to use this method with menstrual cycle of 26 to 32 days should forego sexual activity on days 8 to 19 to avoid pregnancy. The mucus or billing technique is next. It changes in quality and amount just before and during ovulation. There are usually a few days without mucus following a menstrual cycle. These are known as dry days, and they may be safe days if the cycle is long. When an egg starts to mature, it generates a greater amount of mucus. It's frequently foggy, yellow, or white in color. It has a tacky or sticky texture. Before ovulation, it appears to transparent and feel slippery, like raw egg white. It's flexible enough to be stretched between your fingers. Her sleepy days are when her fertility at its peak.
How to use this mucus or billing method correctly?
To use this, avoid intercourse during your period and stop having intercourse as soon as fertile mucus is noticed and for 3 days after the fertile mucus has finished. Next, we'll look at the symptom thermal method, which combines a calendar, temperature, and mucus method to determine the fertile times of the cycle. It has the benefit of allowing a woman to compare symptoms and signs rather than relying on a single approach to identify ovulation. The lactation amenorrhea approach is the last option. Lactational amenorrhea, also known as postpartum infertility, is a temporary infertility that occurs when a woman is amenorrheic and fully nursing. The contraceptive effect of the lactational amenorrhea technique is due to elevated prolactin levels. When the prolactin levels is rise, the production and secretion of another hormone. Now that you've grasped those 6, let's go on the contraceptive approach. Contraception that is administered on the skin is known as contraceptive patch. Estrogen and progestin are hormones that are identical to those generated naturally in a woman's body and are delivered slowly into the circulation. Skin irritation or rashes, headaches, monthly flow abnormalities, fluid retention, nausea, and breast tenderness are all possible adverse effects of using a contraceptive patch. Injectable contraceptives such as progesterone-only injectable contraception use synthetic steroid hormones that are analogous to the female hormone progesterone. The injectable hormone is slowly released into the blood from the injection site. Every 3 months injection is given as a deep intramuscular injection with 150 mg of medroxyprogesterone acetate. Next is the combined injectable is an injectable contraception that contains estrogen and progestin. It requires a monthly injection. The woman's return to the fertility is delayed when she quits using the procedure. Fertility takes around a month to return on average, does not protect against HIV or other sexually transmitted diseases. On the first day of the menstrual cycle, the first injection is delivered. Subsequent injections are given every 30 days plus or minus 3 days. The injectable must be kept at a constant room temperature of 15 to 30 degrees Celsius.
Okay, I get it.
Next is the hormonal implants. Implants are small flexible capsules that are inserted just beneath the upper arm skin. It protects you from getting pregnant for a long time. To insert and remove, a specially skilled skill provider is required. Once the implants are in place, the client will have less work to do. Changing the pattern of bleeding is an observation, but is not detrimental. Next will be tubal ligation or IUD or intrauterine device. Are you familiar with this too?
Yes, I think I heard that before.
Okay, the fallopian tubes are completely obstructed. The vas deferens is one of the two tiny tubes that transfers sperm from each male testicle to the prostate gland. Vasectomy is a male birth control method that is permanent. During this procedure, a section of the sperm transport tube is removed. Barrier birth control techniques also prevent contraception by preventing sperm. The sperm will not be able to reach the egg as a result of this. Condoms, diaphragm, cervical caps, and other barrier techniques are examples of barrier methods. Barrier methods were better when you see them with a spermicide. Now that I discussed everything, what do you want to use as a contraceptive?
I preferred IUD method. Can you explain it to me more?
Yes, I also recommend that for you since you had an abortion 5 days ago.
How to do this method and what are the side effects and are there any warning signs?
IUDs are shaped like a T. With one arm on either side, the doctor will fold down the arms and place this device into an applicator tube. Then insert the first tube through your cervix into your uterus. Once the IUD is in place, the arms will release and the doctor will remove the applicator tube. Most women will not have any problem using an IUD, but since you don't have certain conditions, you may not be more or risk of developing serious complications while using an IUD. These include being at risk for sexually transmitted infections at the time of insertion or having serious blood clots in deep veins or lungs. Did you understand all the things I discussed? Feel free to ask if you have some questions or worries.
No, I fully understand everything. You discussed it very well.
Okay then, your next visit will be next month. We need to check you up every month. If you experience some symptoms, feel free to come over and we will check you up right away.